Yeah, no, it's fine. You can
I haven't
talk.
done this before. So,
Yeah, I like these little conversations, or the ones that are unguarded,
unscripted,
and
okay.
yeah,
That's a specialty, and I said that you know.
Okay.
yeah. So that we're just talking, like it's
Yeah,
cool.
that's fine.
Yeah. So yeah, hello and welcome to another episode of Asitna Conversations right here on Asitna. If you're watching this video, we're going to be having a few conversations. We're collaborating with the Brain and Mind Medical Center. So they are in charge of bringing you these conversations to educate, enlighten you on mental health issues that you need to know, because the conversations are not being had enough and a lot of terms are being thrown around haphazardly, if I should put it. So we're going to try with this series of videos in the next coming weeks to make sure that everybody is on the same page or has enough information or education on mental health conversations. And with me, I have Dr. Nanaya Ojomo. We're going to talk about one of the things people throw around a lot, which is anxiety. So we'll have Doctor explain to us and give us a much more detailed knowledge about what it is, and so that you just don't say that you have an anxiety disorder, self-diagnosing and all that. So yeah, welcome.
Thank you.
Are you nervous?
Just a little bit.
Just a little bit. Is this your first time?
Yeah, first time.
Doing a camera thing.
Yeah. One-on-one.
One-on-one.
Yeah. I've done.
One-on-one means you be talking to me.
Yes.
Yeah.
Yes.
Don't look at my.
Yeah.
Yeah. So I'll first get to know you a little bit, because it's easier to personalize it before we move forward. So how did you get into
Psychiatry.
Yeah. First of all, what's the difference between psychiatry and psychology?
Yeah, so there's a difference. So psychiatry is a branch of medicine, and psychology isn't a branch of medicine.
Isn't?
No. So it's a science. It's a, would I say a social science? But psychiatry is medicine. And to be a psychiatrist, you need to be a medical doctor, first of all, before you can then specialize as a psychiatrist. But to be a psychologist, you don't have to be a medical doctor. So we have medical doctors who are psychologists as well, but we have non-medical doctors who are also psychologists.
Okay.
But we don't have non-medical doctors who are psychiatrists.
That's impossible. Okay.
Yeah, that's impossible. And psychiatry as well has to do with the general diagnosis of mental illnesses and then management. And that includes both use of medications and psychotherapy. Whereas psychology has to do with using psychotherapy as a form of treatment for various mental illnesses.
Which would you say is easier on the minds of people when they think about looking for help?
Yeah, so I think psychologists seem to be like the ones that people
are more
comfortable with,
yeah.
Because I guess it doesn't make it sound like you're crazy. But when you say you're going to see a psychiatrist, because there's a stigma attached to some of the mental illnesses that psychiatrists are typically involved in, you actually need a psychiatrist for example, schizophrenia and bipolar disorder, who people tag as being crazy. People then assume that if you're seeing a psychiatrist, then you must be crazy to see a psychiatrist. Then if you're seeing a psychologist, it means that you just have some mental health problems.
Which is okay, yeah, so in that's conversation.
Okay. Exactly. So I think it has to do with the stigma. It's just a stigma that makes people want to go to a psychologist more easily than a psychiatrist. Yeah.
But when should one see a psychiatrist versus a psychologist?
Yeah, so ideally, if you have any form of mental illness, you need to see a psychiatrist first. And then when the diagnosis is made, then you get referred to a psychologist if you need psychotherapy. Because most of the time you need psychotherapy anyway, so you get referred to a psychologist. But then depending on the illness and the severity, sometimes you could go to a psychologist and they can also make a diagnosis and they start treatment. And then if it gets to a point where they realize that a psychiatrist has to come in, or the severity is such that psychotherapy alone will not work, then they refer it to a psychiatrist. So that's how it is. So either way works, but ideally it's better if it goes to a psychiatrist and then the psychologist is brought on board. But for very mild forms of various mental illness, like a mild depression or an anxiety disorder that's mild, psychotherapy alone can solve the problem. And so if you go to a psychologist, you're still okay. But then psychotherapy alone can solve a problem, and then you can go back to living your life.
Okay.
Yeah.
You mentioned...
sorry to interrupt you.
Yeah,
I just had to add that with some illnesses like psychotic disorders, like as you see in schizophrenia, psychotherapy alone is usually not enough. And so you definitely need medical treatment. And so that's why you need a psychiatrist.
Okay. I'm sure we're going to have other conversations where we get more technical about these diagnoses or things to look out for in terms of symptoms. But today I want to do or have a conversation on one that is, I think, quite common, or at least people throw that word around a lot nowadays, is anxiety. What is anxiety?
Yeah, so I'd say that yes, anxiety is an English word, so it's not surprising that people throw it around easily. But anxiety basically means that you have some fear or some worry about something or about nothing. So for you to have an anxiety disorder, it means that whatever fear or worry you have is excessive and it's out of control, and then it affects your life, whether it is your occupational life, whether it is your social life, whether it's your religious life, whatever it is, it impairs your function as far as those areas are concerned. And that's when it becomes a disorder. So first of all, we all have some anxiety, we all worry about things.
So some degree of anxiety is normal?
It's normal, exactly. And in fact, some degree of anxiety is good.
It's healthy?
Yes, healthy, because it can actually help you, push you on, or motivate you to get things done. But then when it goes beyond that, then it's a problem. When it gets to a point where it's a deviation from the acceptable norm, and then it actually affects your life such that you can't work, you can't sleep, you can't eat, you can't have sex, you can't, do the things I usually do, then it's a problem. Then
Are there types of anxiety?
Yes. So that's what I was coming to. Definitely. So people say anxiety, because Vesta was telling me about anxiety. I'm allowed to say that.
You're not allowed to say that.
Okay. So, I wanted to talk about anxiety, and I mentioned to her that it's a very broad term, because I can get up today and say I have anxiety or have anxiety disorder, but it doesn't mean anything for a psychiatrist, or even psychologists as well, because they can't offer you any treatment until they know what type you have. Okay, so there are various types. So let me name common examples. Some of them are terms that people know of, some are terms that people are not so familiar with. So I'm sure you've heard of the term generalized anxiety disorder.
Disorder.
Yeah, generalized anxiety disorder. You can say general as well. Generalized anxiety disorder. You heard of panic disorder?
Panic, yes.
Then there's social anxiety disorder, what some people also call social phobia. And then there's agoraphobia. And then...
Agoraphobia is what?
So fear of certain spaces. So where people are afraid of being maybe in an enclosed space, in a room where other people are, or on a bridge, or on top of a building.
Okay.
Things like that. So that qualifies as agoraphobia.
It's tied to locations?
Yes, specific spaces.
Right.
Yes. And usually when people have agoraphobia, it usually is accompanied by panic disorder as well. So a lot of people who have agoraphobia also have a panic disorder, because people, a lot of time in agoraphobia, you seem to have a panic attack. So when you're in such a space where you're uncomfortable, you definitely have a panic attack. I'm sure we'll talk about what a panic attack is like. But that's it. I think I've mentioned about 4 so far.
Yeah, panic disorder.
General anxiety disorder.
Social
anxiety.
Agoraphobia.
And then there are specific phobias. So I'm sure you hear people say that I have a phobia.
Claustrophobic.
I have a phobia of snakes. I have a phobia of ants. Have
Arachnophobia.
Exactly, yeah,
All
exactly.
those things.
Spiders, yeah. So those are specific phobias. So some people also have phobias of specific things like insects, animals, and a lot of very different strange things. There are a few more I've mentioned. So to have an anxiety disorder, we usually need to make sure that the anxiety is not as a result of a medical illness, because some medical illnesses too can make you have an anxiety disorder.
Which is like, for example?
So, for example, you can have anxiety symptoms as a result of maybe having a heart problem. So, like a cardiac problem, like maybe let me give a better example, not even heart. So, like hyperthyroidism. So, people who have goiters.
Yes.
So they have thyroid problems. There's an organ in this part of the body that's responsible for metabolic processes. And sometimes it can get damaged, if for lack of a better word. And so when that happens, either the function is too high or it's too low. And usually when it's too high, you have symptoms that qualify for an anxiety as well. So you have palpitations, you have some restlessness, agitation, and those can look like an anxiety disorder. So what psychiatrists...
That's an induced, anxiety induced by a medical condition.
Exactly. So that's why psychiatrists need to make sure, before they diagnose you of a mental illness, which is the ones I've mentioned, they need to make sure that you don't have any of the physical illnesses that can cause anxiety. So that's the example I've given. Another thing too is that psychoactive substances, so like alcohol, cannabis, cocaine, all those things as well can make you have symptoms of anxiety. And so we need to make sure that the anxiety you're experiencing is not a result of those substances, either too much of the substance or a withdrawal from the substance. And so that's another way in which you can get anxiety. I think apart from that, so there are a number of disorders that I'm sure people throw about easily as well. I'm sure you've heard of OCD.
Yes.
Yes, so people mention OCD a lot. So OCD is another disorder which...
It's an anxiety disorder?
No, so previously it used to be classified as an anxiety disorder. So if you check the older versions of the DSM and then ICD, so these are classification systems used in medicine or in psychiatry for the various disorders. The Americans like to use the DSM, the British like to use ICD.
Yeah. So
historically it used to be classified under anxiety disorders, but it's no longer classified under anxiety disorder. But that was because people with OCD have symptoms that are similar to some of the anxiety disorders too. And then also there is PTSD, post-traumatic stress disorder. And then another form of something that's similar to PTSD, acute stress disorder, also sort of used to be classified as anxiety disorders and are no longer classified as anxiety disorders.
Why?
Because I think science advanced, we've got to learn more about them, we've got to learn more about how they are caused and how they are managed. Realize that they are a bit distinct from anxiety disorders, and so they sort of did that separation so that we can identify them better and manage them better. So I think I've mentioned every one of them I know of. Maybe I've probably left one or two out, but there are quite a number of disorders that are classified as anxiety disorders. Yeah.
Which ones are the most common ones? Would you say is the generalized anxiety disorder and panic, because it tends to flow into each other?
Yeah, so interestingly, from the evidence, it is social anxiety disorder that is the commonest. Worldwide.
How did we get there?
I guess, so first of all, anxiety disorders, this is interesting, this is something a lot of people don't know. Anxiety disorders are actually the most common form of mental illness worldwide.
Okay.
So with like a prevalence of, last I checked, there's 20-something, so let's say about 30% of the world's population having anxiety disorders.
That's what has been diagnosed?
Yes, that's what has been diagnosed.
Would you say...
there are more that have not been diagnosed?
By observation of human condition, Obianya correct?
Yeah, I don't know, Obianya correct, but people have different forms of incorrectness. So I don't know if we all have anxiety disorders. But that's actually... To
some degree, no?
Yeah, maybe. But like I said, we all experience some anxiety every now and then. But I also say that maybe the way, we are more... what's the word? Output driven nowadays. So like people judge you so much on
based on what
you can achieve and all that. So there's so much pressure on everybody to, achieve, career, and that kind of pressure can easily predispose you to having one form of anxiety, especially with the social phobia, because that has to do with having a fear of embarrassment or scrutiny when you have to be involved in an activity where people are going to have the chance to actually scrutinize you, or people have the chance to, or make you feel embarrassed. So like what I'm doing today, it causes some anxiety because I'm going to now talk to, it's going to be on YouTube, isn't it?
Yes.
So the whole world is going to watch, and I'm wondering what people are going to say about what I'm going to say. Are people actually going to say that, oh, he doesn't know what he's talking about? He looks like this, I was worried about my hair not being brushed. People are going to say that, oh, you're going to be on TV and you didn't even like prepare properly. You don't look like you're supposed to be on TV, no makeup, whatever. It's okay for me to worry about those things. But when it gets to a point where now that worry about those things make me decide that
I'm not going to show up at all.
Yeah, or feign an illness so that I don't have to do it. I mean, not showing up at all is easy, but so that's okay, sort of acceptable. But going to far, doing so much to make sure that you don't have to do it. For instance, taking some pills so I have loose stools, or so I cutting myself so I have an injury, so that I don't have to do it, is considered a disorder. So that's a problem. So it's an abnormality that needs treatment, and that is typically how social anxiety disorder is. So I guess it's common. That's the most common. Yes, I guess it's from there's the pressures of the expectations that people have of each other in this current world, the hustle and bustle, woke culture. Yeah.
So what should one do when they are confronted with some of these things that drive them to literally want to do something to not show up?
Yeah.
What about these instances where, events or programs or parties or being around people, I may not necessarily have the social anxiety disorder of work-relatedness or performance-relatedness, but just people in general, and having to be an active participant in that sense. How do you navigate such a thing?
Yeah, so if it's such that it makes it difficult for you to do the things that you want to do, like I mentioned earlier, then it's a problem. It's impairing your functioning. So you definitely need help. And so you need to seek mental help. Depending on, like I said, ideally you see a psychiatrist, they talk to you. Sometimes the way you think of the problem might not be how it's exactly, because it might actually be more severe than you think, because you might not even realize it yourself. And so they go into all your problems, talk to you about how it is. Sometimes you might have to speak to people around you, for instance, your parents or the people you work with, to see the gravity of the problem. And then when a diagnosis is made, depending on the severity, like I said, you need treatment, and treatment involves medications and psychotherapy. So typically, if it's mild, the psychiatrist might just say, go see the psychologist, and they'll have a number of sessions with you, therapy sessions, and then they get to help you deal with those thoughts. Because the thing about a lot of mental illness is that it has to do with the mind, okay? So it's about thoughts, feelings, emotions. And maybe we'll talk about that a bit later, but how these anxiety disorders arise have a lot to do with our thinking, our adaptive mechanisms, our defense mechanisms, and things like that. So the psychologist will go into those things and help you realize them, and then show you ways of dealing with them better, so that you don't have that kind of breakdown in those systems, and then you can actually face the situations that you previously wouldn't be able to face. So you basically need to see a psychiatrist, get diagnosed, and then get the appropriate treatment, which involves psychotherapy and medications. For an anxiety disorder, typically the treatment, medication-wise, would take months. So that's what a lot of people typically are not happy with, the fact that you need to take medications for so long, because nobody wants to take medications for a very long time. It's not like, I always say that, it's not like malaria where you take medications for 3 days, maximum 5 days, you're better and don't need a medication. Even when you are better after taking medications for a couple of weeks or months, you still need to be on the medications to prevent the illness from recurring. Okay, so typically you have to be on medication for about 6 months to a year. And that depends on the response to the medication. And there are so many options when it comes to treatment. So if one medicine doesn't work for you, the psychiatrist will then have to change to another one, which might work for you. And then it goes on until you're better. And then you go on to take it for about 6 months, depending on how things go. And then eventually they'll reduce the doses gradually, and then you stop. And then after you stop, sometimes you need psychotherapy to also support you, to make you keep on and then ensure that you remain well. And then you can live your life normally again. So it sounds like it's simple, but
it's not really
it's
simple.
not that simple, yeah.
The conversation around anxiety, of course, the reason why we're doing this is that it seems to be a buzzword now. There are movements or self-diagnoses that have, seeped into popular culture. People saying, okay, who's an introvert and who's having an anxiety disorder? So how do we define that personality trait? Is it a trait, right? An introverted personality trait versus using, I'm an introvert to not show up and, be social.
Yeah.
How do we draw the line? Where's the thin line between that?
Yeah, so, to even first of all say that you have an anxiety disorder or any mental disorder to begin with, you need to make sure that it's a deviation from your usual self. So, like I said, to make a diagnosis, the psychiatrist will talk to you, talk to family, people around you. And so we need to know that that's behavior that everybody's seeing now. Is it something that's already the way you are, or you weren't like that and now you've changed? And that's when we start thinking that it's a problem. Because if I'm an introvert and I've always been an introvert and I don't like to go to places where everybody else wants to go to, then I'm okay. There's nothing wrong with me. Okay, that's perfectly normal. But then if I was an introvert and then months down the line or years down the line, all of a sudden, if I'm an extrovert rather, and everybody knows I like to go to places, I like to, be on TV, be on radio, and all of a sudden there's a TV program that people expect me to come to, and then I say, I can't go, then we think that there's a problem. Okay, so that's one of the ways of distinguishing the two. So it definitely has to be a deviation from your usual self, and then it has to cause distress to you, the individual, or the people around you, and then it has to impair your function, like I said, your social life, your career life, your
So that will bring me to
life.
how early can such a disorder be diagnosed? Because introversion or personality traits,
adult.
that it can only be diagnosed. Are those brought up when you're an adult or as a kid, a baby? I don't know. If you, from maybe infancy, you've generally been socially anxious, and because of that, in your defense, you're quiet, you are more reserved, so you don't have to face those things. How do we know when your introversion started and what it was like defending you against?
That's an interesting question. So the truth is that majority of our personality is fully developed when we are adults. So you start forming a personality from childhood, all the things that happen in your life, the stressful events, the traumatic events, the upbringing, parenting, all those things contribute to your personality. So by the time you're an adult, your personality would have sort of fully formed. So, but that's not to say that you don't diagnose anxiety disorders in children. So even as early as 11 years, teenagers have anxiety disorders as well. So the thing is that it's more difficult to diagnose anxiety disorder in a child compared to an adult. Because an adult is easier because you know what the person is like, what their routines are like, what their worries are like, and so you can diagnose. But with children, first of all, they might not even be able to tell you that they can't do this or they are experiencing this, but you have to judge from their behavior. And so usually you need the parents' help as well, because the parents usually knows the child because they usually would live with the child, and so they know what the child does when they are afraid, what the child does when they're hungry, what the child does when they're sad, what the child does when they are sleepy. So you might not necessarily have to find out about their personality or whether they're introverts or not, but you can tell from the parents being able to know that, yes, my child was like this and no longer like that. And then you can make a diagnosis,
Okay. When does it become a panic
disorder.
disorder.
Yeah. So
Is it linked in any way? Does one have to lead to one, or one can have panic disorder without necessarily having a generalized anxiety disorder or social anxiety disorder?
So well, they are linked in the sense that the symptoms that one experiences are similar, but they are not necessarily, one does not necessarily lead to the other. But for example, you can say that someone with agoraphobia is prone to having panic attacks. And so it's likely that someone with agoraphobia would have panic disorder as well. And in fact, I think the research shows that about 95% of people with agoraphobia have a panic disorder as well. So those two, yes, we can say they're linked. But the others, not necessarily. And they all have a different etiology and different ways that they come about. So a panic disorder, so generally, like you say that people have anxiety, you have worry, you have a fear of something, an unknown event happening.
Whether
you have
rational or not.
Exactly. You have some palpitations. Sometimes you feel like you can't breathe. You probably sweat a lot. You can't sleep. You see all these happening in almost all the anxiety disorders. But for someone to have a panic disorder, you have to, first of all, have a panic attack. Okay, so you need to have multiple panic attacks. And the panic attack essentially is, so it's almost like someone having a heart attack. So it happens suddenly, you're fine, you're living your life, doing everything, and all of a sudden you become afraid that something is about to happen to you. And then you start breathing fast, you start feeling your heart beat fast, you might start sweating, you might feel like you can't breathe. Some might even collapse. So some actually collapse when they have a panic attack. The good thing is that panic attacks don't last too long. So it might last a few minutes, maybe 5 to 10 minutes, and then it stops. Okay, so sometimes people who have panic attacks are misdiagnosed as having either a heart attack or a seizure, because in seizures as well, you can maybe shake and then fall and collapse. So that can easily be misdiagnosed, but then knowing the events surrounding what happened can help you know what the diagnosis is. So if someone has a panic attack and they have multiple panic attacks, you can diagnose a panic disorder. Okay, but then also if they have just one panic attack, and then after that, let's say for a month following that panic attack, they start having unwarranted fear of having another one because of what happened. And then their behavior changes as a result. They start, maybe being overly anxious. They can't sleep, they can't eat because of what happened in the past.
Yeah,
this goes on and on. Yes, and it goes on for up to a month. They can actually diagnose as panic disorder as well. Yeah,
okay.
So
one of the things I'd wanted to know is are these general anxiety disorders or anxiety disorders, can they be genetic?
Yes. So like all mental illnesses, there's a strong genetic component. Okay.
So they can be genetic?
Yeah, they can be genetic. But the catch is that they are genetic, but they're not purely genetic. In the sense that, yes, so an example like schizophrenia, which is a mental illness, is known to be strongly genetic. So if one parent has schizophrenia, chances of one of the children having is really high, probably higher than 50% chance. Yeah, that's really high. But even with that, you need an environmental component as well to come together to trigger the illness. So same with almost every mental illness, you need a genetic vulnerability. So that's something that predisposes you to having the illness first of all, and then the social stresses will then come and sort of induce the illness. So mental resilience is actually protective against mental illness. So people who are resilient are less likely to have a mental illness.
Yeah.
And people who are vulnerable are more likely. And that vulnerability is genetic. Okay. But you need the two components to come together to form. I won't say that, people in my family have had an anxiety disorder, so I would definitely have one. or one of my parents has a mental anxiety disorder, so I'll have one. Whereas you can say that for schizophrenia, in anxiety, you need a bit of that and then a bit of the social stresses. When I say social stresses, it starts right from childhood to adulthood. So even traumatic experiences, like maybe sexual assault, physical assault, parenting style, verbal assault, loss of a loved one,
trauma,
any form of trauma. All those things are the social stresses that can push somebody who is genetically vulnerable to having a mental illness, for example, an anxiety disorder. Right. So that's how it works. And it applies to most of the mental illnesses, like even depression as well. So depression, anxiety, but the ones that are strongly genetic are schizophrenia, bipolar. As for those
those are very strong.
Yeah, those ones, the skill tips a bit towards genetic more than the social stresses. Whereas in anxiety, depression, and co, it's sort of like a balance. Yeah.
Okay. When should one see a physician or psychologist or psychiatrist?
Yeah.
When? And how should one do it? Because, like you explained in the beginning, psychiatry and psychology, which one is more approachable and everything. So, when should someone visit either?
Yeah, I'll say as soon as possible, as soon as you realize that. So let's have an individual who's experiencing it. So as soon as I'm experiencing these symptoms and I realize it's a problem, it's affecting my life, I need to see somebody. But then also, if you on the outside see a friend or a colleague who has any of these things, you can approach them and let them know that, yes, they need to see someone. So as soon as it's seen, the earlier the better. Because something we probably haven't mentioned is that with anxiety disorders, the longer they go on for, the more likely the individual is to experience other psychiatric illnesses, such as depression. So if someone has general anxiety disorder for a long time, it's just a matter of time and they might develop depression as well. So he asked me whether they are linked. Yes. But this is how they are linked. The other mental illnesses are linked, so that we say people have comorbid mental illnesses. So they can get depressed. They can also resort to using psychoactive substances. Because let's say I have depression, I use cannabis, it sort of calms me down and I'm happy. Or I take in alcohol, I'm able to sleep. So it solves my problem. So that's how it starts. I continue using them before I know I'm become dependent on the alcohol. So then people with such disorders also then are prone to abusing these substances. And then that can also become a mental illness on its own. So we say that you need to see a health provider as soon as possible. Now the question of psychiatrists or psychologists, like I said initially, ideally psychiatrists. Previously, you would find psychiatrists in only mental hospitals, especially in Ghana, because you don't have so many of them. And so nobody wants to go to a mental illness because once you go there, everybody will say you're crazy or you're mad.
You touch.
Exactly. But now you have psychiatry services in general hospitals as well. So you can go to a hospital like Kolebu or 37 or Bridge Hospital. The general hospitals would have psychiatry services. Okay, so if I enter one of those hospitals, nobody can tell what I'm going there for. Okay, so I would say it's easier now. Okay, so you can still go and see a psychiatrist and still get your help. But then it's okay to see a psychologist as well. But the truth is that if you go to a psychologist and they realize that you need therapy alone will not solve your problem, and need a psychiatrist, they'll refer to a psychiatrist as well. So I think either way is fine. If you go see a psychologist first, that's fine. If you go see a psychiatrist, that's also fine. But ideally, it's better because, mind you, like I said, you're going to have to make a diagnosis. And if you're a doctor first, it's easier because we mentioned that certain medical illnesses can cause symptoms
So you'll be in a position to find out
whether it's actually a mental illness or not. You're at an advantage. Okay. But then you also have medical doctors who are psychologists, and so they might also be able to pick up such problems. Yeah. So I'll say as soon as possible. And there are there are private facilities as well who offer general care and they also provide mental health services as well. So there are so many private facilities in Accra and beyond who provide mental health services. Yeah.
So like the brain and
yes,
mind,
like the brain and mind
medical center.
Yeah, yeah.
Would you like to touch briefly on, before we wrap up, briefly on generalized anxiety disorder? Because I was of the
opinion
that being generalized, it would be like
more common.
I didn't expect social anxiety disorder to be the most common.
Yeah. So
what is that one, and why?
So
isn't it the most common?
I'm not sure I can answer the question of why it isn't the most common.
But what is it?
But yes, general anxiety disorder, from the name generalized. Okay, so they have anxiety symptoms not related to a particular problem. For instance, you see in panic disorder, you can tell that this person's having a panic attack and it's clear. But in general, and let's say social anxiety, we know that it has to do with performance, exactly, yeah. And then specific phobias have to do with particular things. But in general anxiety, you can't pinpoint to why the person is having the anxiety. So in the person's mind, they might be worried about one thing or the other. So they are worried about a number of things. And then they are worried about a number of things now show in terms of anxiety symptoms. And I think I mentioned a bit about how anxiety disorders come about. And one common way is the fact that our subconscious, there are some things that you might subconsciously express, but because you're aware of your society, you're aware of the expectations, your ego sort of doesn't let you express them. So you resort to using a defense mechanism known as repression, and sort of you repress those feelings. So maybe you have a tendency to get upset or get aggressive about something that upsets you. You know that, if you do it, there are consequences, so you probably won't do it. Your ego won't let you do it. It gets repressed, and then at a point in time, maybe the body can't take it anymore, or the mind can't take it anymore. Then it starts exhibiting itself through maybe your heart beating fast, the physical symptoms. You getting worried about something that you don't even know why you're worrying about. You not being able to sleep. Sometimes you can actually have pain. So you might even have like a headache, persistent headaches, and you don't know what is causing it, but it might be because of anxiety. You might have some muscle pain. Some people actually have maybe some twitching movements of some muscle groups. So you might sit down and just keep shaking their foot, and that's also a manifestation of anxiety disorder. So those are some of the things you see typically in a generalized anxiety disorder. And most of the time, you won't be able to pinpoint what the person is worried about. And like I said, you can have one mental illness with another mental illness. So it will lead to it
eventually if it's not.
If it's not.
I'm glad you brought the manifestation in the body up, because now I want to know, when you have these disorders, does it release certain hormones that cause the body to behave that way?
Yeah.
Is that how it's?
Yeah. So first of all, apart from the fact that these disorders, the fact that it's called a disorder means that science doesn't know the cause. Okay, so typically we use disease like, say, malaria. We know that mosquito bites you, there's a plasmodium parasite, and it causes it.
Right.
When it comes to a lot of the mental illnesses, we don't know the particular cause, so we call them disorders. And because you know the particular cause, there are theories. It doesn't mean you have no idea about them. You definitely have an idea. So we have theories that, because of the way mental science is, you need to fulfill certain conditions to cause certain things. So there are theories as to how these things come about. So there are theories about how there's an imbalance in certain neurotransmitters. So the chemicals that are released by the brain cells, that the brain cells communicate with each other. Sometimes there's an imbalance. So something like serotonin, dopamine, noradrenaline, there can be imbalance in these ones, and that can give rise to an anxiety disorder. But also, some of them mediate the symptoms. So like you rightly mentioned, something like palpitations, jitteriness, agitation.
Yeah.
Those ones are typically mediated by norepinephrine, or what we call adrenaline.
Yes.
So adrenaline, noradrenaline. So the activity will go up, and then will cause the physical things that you experience. So your heart beating fast, you being jittery, you sort of being hyper and all that, yeah, sweating and all that, yeah. So those neurotransmitter systems, there's something also called the autonomic nervous system, which uses these neurotransmitters. So those are the things that mediate such symptoms, yeah.
All right, so I think I'm gonna
Oh, let me say one more thing before
One
you
more
go.
thing, okay.
Yeah, it's important. So even though you're supposed to go see a psychiatrist or psychologist,
Yeah.
it's okay to also see a general practitioner. Because, you know, with anxiety disorders, because you mentioned that people have physical symptoms like headache and palpitation and stuff, you end up being with a general practitioner anyway. And so they would be able to diagnose as well and then refer you. So if they realize that maybe what you experience is not a result of a physical illness, then they refer you to see a mental health provider as well.
Yeah.
So it's okay to see your general practitioner as well. So you don't have to go find an appointment with a mental health provider per se, if you don't have access immediately.
Or if that scares you to
Exactly,
thinking that you're worse off than...
Yes, and they can also start some form of treatment while you wait to get an appointment with a psychiatrist, yeah.
All right, so it's good that now we know what these things are, and it's okay to feel these things. If you're watching this video, it's okay, you're not alone. Most people go through some bit of it in their lifetime. So yeah, you should seek help, talk to someone, and hopefully you get the help that you need. If you're looking for help and you're in Accra, you can also check out the Brain and Mind Medical Center. They're on Facebook. Brain and Mind Medical Center is everywhere. That's in Facebook, Instagram. You can just reach out to them, and I'll put their details in the description for you to also reach out to them if it's something you want to pursue, which you should if you're going through any of these things. So we're going to thank Dr. Jumo for this great education and elaboration on our first episode, coming back into the mental health conversations. So stay tuned for our next episode, and we'll catch you in the next one. Adios.
Thank you.